Good afternoon, folks. I've got discussion A for you. Now we're discussing a sort of pilot program in Pittsburgh for seniors. So thought this was an interesting one to do. So shall we dive into discussion A and see what it entails? The phrase "from singing robots to living laboratories" captures Pittsburgh's dual strategy for tackling the challenges of an aging population, embracing futuristic technologies while grounding innovation in everyday caregiving environments. It signals that local leaders are not relying on a single solution, but weaving together high-tech experimentation and hands-on training to address workforce shortages, care gaps, and the growing demand for elder support. Okay, context: Pittsburgh's aging landscape. Demographic reality: Pittsburgh is one of the oldest metropolitan areas in the United States, with nearly 1 in 5 residents over 65. This demographic tilt places enormous pressure on health systems, long-term care facilities, and family caregivers. Caregiver imbalance: the ratio of older adults to available caregivers is widening. Many facilities struggle to recruit and retain staff, while families face burnout from informal caregiving responsibilities. Regional urgency: Pennsylvania's broader aging trend amplifies the local challenge, making Pittsburgh a microorganism of national debates about how to sustain elder care in the face of demographic change. Singing robots, shortened for geotechnology, symbol of innovation. The phrase invokes social robots and interactive devices designed to provide companionship, cognitive stimulation, or reminders for daily routines. These tools are not meant to replace human caregivers, but to supplement them, easing workloads and reducing isolation. Examples in practice: robots that sing or talk can encourage engagement in memory care units, while Sensor-equipped devices monitor health indicators and or detect falls in Pittsburgh. Pilot programs are exploring how such technologies can be integrated into assisted living and home care. Broader trend. Geotechnology is part of a global movement toward aging in place, where digital tools from telehealth platforms to smart home sensors help older adults remain independent longer. Living laboratories testing care models in real homes. Hands-on experimentation. Unlike sterile classrooms, these labs uh, replicate the unpredictability of real households. A seemingly ordinary house in Oakland, for example, has been transformed into a training site where caregivers practice scenarios ranging from medication management to fall prevention. Workforce development. Students, nurses, and aides can rehearse responses to emergencies, learn how to use new technologies, and adapt to the emotional complexities of elder care. This bridges the gap between theory and practice. Community integration. Living labs also serve as hubs for collaboration between uh, universities, health systems, and community organizations, ensuring that innovations are tested with cultural sensitivity and practical feasibility. Why this approach now? Demographic urgency. With Pittsburgh's aging population accelerating, leaders recognize that traditional models of care cannot keep pace. Workforce crisis. Chronic staffing shortages demand creative solutions. Training pipelines. Retention strategies and technological augmentation systems level response. By combining geotechnology with living labs, Pittsburgh is positioning itself as a test bed for age friendly innovation, potentially offering models that other regions can replicate. The core takeaway. The headline encapsulates a story of adaptation Pittsburgh's care leaders are experimenting with both whimsical seeming technologies like give me 1 second. Singing robots and pragmatic training environments like living laboratories. Together, these approaches reflect a commitment to meeting seniors' needs with creativity, rigor, and community engagement, ensuring that aging is supported not only by machines but by human centered systems designed to preserve dignity, independence, and quality of life. Okay, guys, so that is A for you. I will be back on shortly with B. Give me a bit to put that together for you, and I'll be back on with that. For now, Gator Wellness, take care, folks.